Dental Podcast,
where real people, real stories,
and real life come together.
This is the Life and Dentistry Podcast.
Hello, everybody. Welcome back to another episode of the Life and Dentistry Podcast.
Dude, I'm pumped about tonight. This is going to be fun.
Yeah. So pumped.
This is going to be a good episode. But we're missing like over half our crew. For good reason, most of it. John Wesley just texted me, said he's fixing to be holding his newborn child in like an hour. He's at the hospital right now.
That's crazy. Hope everything goes well. I know it will.
Yeah,
it's crazy to think.
Praying for you, buddy.
It's crazy to think back how, when we started dental school and nobody was married except Lou. And now just about everybody's married except me and Daniel.
Except Cole.
Half of everybody's pregnant. Joe looks like he's pregnant. I mean, it's just crazy how times change.
It is crazy. It's unreal.
Yeah, time flies, man.
Joe, tell us about this new backdrop you have here on Zoom.
All right. Everyone has to go to YouTube and watch the videos. I made my own green screen in my house.
So let's flip through some pictures that you have that you can put on your green screen.
Okay. So right now we've got the Life and Dentistry up. And
Let's just say it looks really high end.
we got some America. Got the American flag behind me.
America.
We've got the Weather Channel here. You can
Hey, what is the weather going to be tomorrow, Joe?
Well, if you kind of take a look here, out west, we got this high front coming in. Arizona, Texas is looking pretty good.
What does H stand for?
H stands for high pressure, which is pushing low pressure.
How do you know it's not for high temperature?
No. Al Roker always says high pressure.
Oh, Al Roker. I remember Al.
Yeah.
All right, what else do you have here?
All right.
You have implant pathway.
I got the Canadian flag up. We had a little interview with from Canada earlier today, so I was representing our Canadian friends. Canadian listeners, this is for you.
Hello.
Get on YouTube and check it out. You might even hear Cole sing
Canada. That's all I know.
That's great, buddy. And now we're on the beach. This is the beach here. Dude,
that was my view 2 days ago. How about that?
You're a lucky son of a gun.
I think I might have even taken that picture.
And this last one, I want to give a nice little shout out to Justin Moody and Implant Pathway. We have your logo on our screen right now. And this is Lou's view a few days ago.
Yeah, speaking of, this is like a perfect segue. It's almost just sheer brilliance from Joe and his green screen. How about that?
Well, thank you very much, Cole.
Oh, no.
Yeah, so today is a very exciting episode.
Wonder how long it took him to think of this. Genius.
Can I tell? All right, in just a second, we're going to talk about Lou's implant trip.
All right.
But so 2 days or last week, I wanted to do a green screen and get a virtual background. So I sat on the internet for like 2 hours trying to look this up. So I went to Dollar General and bought 6 pieces of green construction paper and taped this up with duct tape. So all you can see is this, but really it's like this raggedy green cardboard paper.
Has Kayla seen this?
No. I folded and put it away.
How does Kayla feel about all of this?
She would not. Kayla does not need to know about this green screen.
So this is not permanently fixed on the wall.
No. I would be in big trouble. I'm just hoping it doesn't.
So you tape it in and out.
Yes, and I have some extra paint.
Oh no!
So if I take the paint off, I'll just fix it. So that's the story.
So this isn't Kayla approved?
No way, dude. Be in big trouble. All right, Lou. Man, you just got back from Phoenix. Everyone
Yeah,
saw your
man. It was yeah, I had a lot of good pictures up.
Yeah, we
Had a
threw
lot
that
of
all up on social media.
mandibles.
Everybody loved it.
Yeah, it's an amazing thing to get to experience that in real life, man. It really is. I'm blessed and fortunate to have been able to go and do that. You guys know one of the main reasons why I came to the job that I'm at now is to be able to get the opportunity to go and do that. And so, as Justin Moody likes to say, I went down there, dropped some screws, slayed some mandibles, and slayed some maxillas, and got it done, man. It's extremely awesome opportunity.
So how was it set up when you flew into Phoenix, stayed the night there in the hotel, woke
Mhm.
up that morning? I guess what was it? Friday morning you started?
No, let's see. So Saturday was our last day. Friday, Thursday, uh, Wednesday. So I landed on Tuesday night.
Okay.
All right, and Wednesday morning, woke up, went and did the Camelback Mountain.
Yeah.
I hiked that, and then at 2:00 we all met at the Brighterway Clinic. And so there's some vans that picked us up at the hotel, took us over to to the Brighterway Clinic, and we kind of got an introduction to the clinic, because the clinic runs all year round. They have doctors there, they have residents there running it and making sure that these patients are being seen.
Is this more of a
They're
public
screening
health
the
clinic?
patients, they're treatment planning the patients so that when a group comes in to do the implant pathway. Um, yeah, I would say so. It's geared towards homeless veterans,
Mhm.
and some of the people there are extremely needy. It was a really cool thing to see, just the vision behind it, and just giving back to the community. But yeah, so Wednesday we did the whole presentation and got introduced to the clinic. We were told how things would go. And then on Thursday morning is when everything started. So you get all day Thursday, all day Friday, all day Saturday of just surgeries.
So how was what can you take us through what Wednesday was like when they were kind of explaining to you how things were going to go? What was that conversation like on Wednesday?
So on Wednesday, we got to meet the clinic director and his vision and what the clinic does, and basically what we would be doing for the next 3 days. Uh, Dr. Justin Moody introduced all of the staff and the team that he brought to work with us. And he also went over a lot of the surgical concepts that we learned in the other sessions of the course. So in my particular situation, there was 15 doctors there, and this was a closed session just for affordable denture doctors. But he does the private doctors as well. So Big Joe is going in September, and those will be private doctors. In my situation, it was affordable doctors. So they just told us how the clinic runs. They told us the vision. They told us, just gave us an idea of what things would be like. And Thursday morning, we walk in, and they paired us up in twos and put us
Dude,
in different
how
operatories.
nervous were you?
I was anxious. I felt like I had some pressure on me. I didn't sleep very well the night before. Obviously, this is a learning place, and so you're there to learn. But at the same time, you feel some pressure. I did feel some pressure. I wanted to do a good job, and I didn't want anybody to think I didn't know what I was doing, even though this is something we're learning. I studied. I studied what Dr. Moody taught us. I studied Dr. Mish's book, and just have the basic knowledge of implants and the biomechanics and how things should go. And I had a month at Affordable where I was just doing a ton of extractions, a ton of flaps, a ton of sutures and closures. So I felt comfortable with that part of the
So,
surgery, and
dude, like
basically
for me,
just learning.
what's the mindset that I should have? Like, so you were affordable, and you were like doing all you do is surgeries, extractions, sutures. Like, I might do a couple extractions a week. Should I be should I prep any different than you did?
Well, so my session was geared more for edentulous mandibles. So the private practitioner, more often than not, they're doing a lot of singles. So your session will be geared more towards doing a ton of singles, and all of you guys will get to do at least a edentulous patient, but you'll get to do a lot more singles than we did. There was some singles here and there for some of the other doctors, but I just did edentulous patients, and so there's no way you can really prep for it. I mean, what you get at your office, just ask your doctor if you can get all the extractions and practice the extractions and practice your suturing on that. And you were asking me earlier, I actually did this at home when I first started with Affordable. My suturing skills weren't very good. So I took a hemostat and some scissors from the office, and I brought it home, and I bought a banana, and I cut that, outer layer of the banana, and I just sutured for a couple of days and just worked on different techniques. And I thought it was really helpful.
That's a really good idea. I think I'm going to do that.
So Lou, when you started dropping screws in this course, I mean, obviously there's a lot of dentists that go through there and have never placed an implant, whether it be dentulous or it's a single implant. So when you get in there Thursday morning, is it you and the doctor you're paired up with going in there, taking a tooth out and just going ahead and placing the implant? Or is it at first like, Dr. Moody or Frymouth or whoever else is right there saying, you just making sure, that it goes in right? Or is it pretty much you just come prepared and you just do your thing and they're just walking around? Is that how it's set up or what?
No. So Dr. Moody brings a team of doctors who are all very successful and are very good at placing implants. And so they're usually paired up with you. And every morning and afternoon, they switch out. So you get to learn from all of the doctors by the time that you're done. So it's a pretty neat situation. It's you and a partner in an operatory, and a patient will come in and it'll be seated, and they'll be seated, and you have assistants that work there. So they know how things run.
Oh,
and
so
that's
you
very
had an
helpful.
assistant
And so
while
you
you
see
were
the
there?
patient. Oh yeah, all of us. We had assistants. I had different assistants every day. People come to the clinic and volunteer their time. Some of the assistants work there full time. It's a huge operation. It's hard to explain until you're actually there. But the clinic is a big clinic, and it runs every day. They have a staff and they have a team. They have doctors who see these patients, and these patients we were seeing were specifically selected and treatment planned so that you're not getting a patient and you're wasting your time because they're not, a candidate for an implant. So you're getting somebody who needs the implant, has been seen, has a cone beam. And so when a patient sits in your chair, you're going over the cone beam and you're looking at that with your instructor. So you're not by yourself, because like you said, a lot of people who come don't have any experience. And so we go over the cone beam, we have a plan, and my whole thought process and my mentality was to just go for it. And my whole thing was, I have these guys here who are really good looking over my shoulder, and I'm confident with what I know, what I've learned from the textbooks and from the lectures. And so what I would do, I would have the drill positioned, and I would say, this is where I would go. Does this look like an accurate location or accurate spot? And they'd be like, well, I'd go more mesial or more buccal, and as far as doing the osteotomy for the implant. But there's no reason to fear, because if you're scared, it slows you down, and
Exactly.
and you're not helping yourself or your patient. So
Dude, it's
you have to
cool.
be confident and know that they're watching your back.
So me and you went to dinner with or lunch with my boss, Dr. Bryant, the other day, Lewis. And like he went to the Maxi course. And I think it was like 10 years ago, maybe 15 years ago, he went through. And he was talking with Lewis and kind of asking, like, did they let you go straight to place implants, or did you have to like show them on a model, this is what you were going to do, and then you got to go to the patient's mouth? And I guess I guess this is kind of a unique course a little bit in the fact that you really get to do a lot of clinical stuff. Like you're placing a lot of implants, kind of just going with it more than some other courses.
Yeah, I mean, as far as live surgeries go, there's very few courses out there that allows you to go in and get your hands dirty and put the book knowledge into practice. So I dumped 40 screws, and a lot of other doctors, were pretty close to that. And granted, a lot of our patients were getting a lot of implants on one person. So I had a case where I had 6 on top, 6 on the bottom. That's 12 right there. But it's hard to compare. There's a few other courses out there that allow you to get this kind of opportunity. And not only that, our first morning there on Thursday, we were doing the prosthetic side of things. So we were taking impressions, we were doing chairside pickups, we were doing uncoveries, for second stage implants procedures, and they packed a whole bunch. I mean, I was on my feet from 7:30 till 7:30. So for 12 hours, you're just working, but you're enjoying it
Did you get to
because the
eat lunch and
patients are
stuff?
so grateful. Yeah, they have lunch, and it's
Good.
just grab and go. They have sandwiches and stuff out there.
So
And
no buffet
grab
or
a quick
anything?
bite. You got
Joe's
cut off.
not doing it then.
What was that?
No buffet. Joe's not in.
Is there a buffet for breakfast or
Yeah.
lunch or anything?
Well, it's definitely a buffet. You can get up there and just stuff your face as much as you want.
That's going to be me.
But you're missing out on implants. So I'd rather drop screws and be stuffing my face with burritos.
No, that's true.
Not Joe. No. So, hey, Lou. Okay, so you were saying, you would kind of hold the drill in position. They'd say move it more easily or whatever. What are some things that
Yeah.
you learned from this hands-on course that, I mean, if our listeners don't know, I mean, you have been throughout dental school and now in the early part of your career, implants are like your passion. So you've done a lot of research on implants. You've done a lot of thought on implants, talked to a lot of people about implants. So you have a pretty good background of a know-how and the procedure and all that. But it's just different. Obviously, I can imagine if you go in and you have the drill in your hand, you're actually working on a live human. And so I'm sure there are some things that maybe were different that you didn't quite expect or you learned through the process. So can you share anything that you learned that maybe you didn't expect or was different now that you were working on an actual patient?
I think the biggest thing that you need to understand is things aren't as difficult with implant dentistry as they made it seem. I learned some things and some concepts that you can apply for every patient. For example, you want to stay within the mental foramens when you're giving an edentulous patient implants. And so we figured out how to do that. And there's a technique that we learned, and you find where the midline is, and you go 7 millimeters from that midline. You drop an implant 10 millimeters from distal to that. You drop another implant. Then you go back to the midline. You go 7 millimeters to the other side, and then 10 millimeters to the other side. And there you go. You have 4 implants right there. You have an implant retained denture, and it's an easy concept to just keep in your toolbox.
But that doesn't work for everybody.
That's what I did.
If you're trying to, you said you're staying anterior to the mental foramen doing that?
Yes. And that's just, it varies on the patient. So patients who don't have enough bone in the posterior,
Right. This is a good case for
usually, you have, right.
We don't want
and in
people to
my situation, go ahead.
Well, I was just going to say, we don't want people to get the wrong impression. Like we're saying, like dumping screws and dropping screws, like it's something like we just want to do. I mean, you're making an impact on a lot of people's lives, man. You're giving them the ability to chew that they can eat a steak like they've not been able to eat in a long time.
Right. And the patients, they don't come to you for the implants. they come to you for the teeth. They come to you for the smile, for what they'll be able to do with it, for the food they'll get to eat, and the
Quality of
events they'll get
life.
to visit again, see their families again. And I was just talking about a basic concept that can be applied to most patients. And I mentioned that in particular because in my situation, in my office, I don't have a CBCT. And so I have to apply certain principles that were used, maybe not in the past. I mean, you can still use them, but nowadays the standard of care is to have a cone beam, right? If you're doing a lot of hard cases.
Oh yeah.
So I have to try to stay within my comfort zone. So I'm not going to be doing, any maxillas without a cone beam in my office. Basically, I'll be staying in the mandible until I can get a cone beam, and you can plan better. Because with the cone beam, you can get a full 3D picture, and you can plan exactly how big your alveoloplasty has to be to have the 6 millimeters of bone that you need in width. And once you have that map in your head, you're just applying it to that person. It's pretty straightforward.
That's true, man. So I got a question for you guys. So I'm getting ready for this course, and I know I'm going next month. To me, the most important thing for me this year is really to get proficient at all aspects of dentistry that I do, but especially implants, because I don't have experience placing implants, and I need the cases. I need the cases to follow up on. I need the experience on tissue management and all these things. So I'm thinking about offering implants at a really reduced rate, almost for nothing, maybe a couple $100, $1,000, whatever, just so I can do it. Do you guys think that's a good idea?
I mean, I think it's a good idea if you can still, set aside time to make what you need to make to survive and pay your bills and all that. And Dr. Bryant's good with it. I mean, if the situation's right, I mean, I would try to do something like that just if I wanted experience and be able to help out the patients, and so you both kind of get something out of it.
Yeah.
I think that's a good idea.
And it's a good service to a lot of people, man. 3 people this week have came in and they can't afford implants. And I tell them yeah, I'm going to take this course. I can place implants on you really cheap. And the only downside is, I'm following up on this. This is something new to me. It's going to be good quality care, but my failure rate is probably going to be higher at the beginning.
You said that to the patient?
I've told them that. Yeah. I've laid it all out there. I feel like I needed to.
I don't know. I mean, I guess if that's the approach you want to take, I mean, I would try to voice it a little more confidently.
I mean, I voiced it pretty confident. Everyone I said, the patients that presented it all have consult appointments coming up.
Yeah.
I think it's a good idea. I mean, it depends on your practice owner. Is he okay with you offering cheaper implants for the sake of experience?
Yeah, he really is.
I mean, it's a good investment. It's a good investment on his part because you're an associate. And if you get good at doing implants, the more implants you do, the more confident you are when you're telling them to your patients.
Exactly.
And there's no other solution.
Yeah, Cole, we do.
Okay.
So that helps a lot.
But like I was saying, yeah, I mean, that's huge. I mean, that right there gives you enough confidence to tackle most things. But the more you do, the more confident you are. It shows in your language and it shows in your body language when you're talking to a patient. And if they can understand that it's something worth investing in just by looking and listening to you, I mean, you can make that practice a lot of money, and you can make that owner doctor a lot of money, even though initially, he might be losing some by you giving the treatment cheaper.
Exactly.
I still think it's a great idea, though.
But plus, when you're taking that course, you're going to automatically feel a lot more confident too, I'd imagine. After September, when you take implant pathway course, you actually get some
Yeah,
screws placed.
I
I
agree.
think that's going to do a ton for your confidence, and you'll be able to come back your patients and say, yeah, you've placed them and you feel really great about it, and you don't expect to have any problems.
That's the
I
thing.
would just word it the same way you would any other patient. I mean, especially after you've taken that course, I would just word it that implants in and of themselves have like a 98% success rate. You're a healthy patient. I don't expect any issues. It's just like with any other procedure, we can't guarantee anything, but I don't expect anything out of the ordinary to happen, and I think we can place you a very good implant and get you a very nice crown and replace your tooth.
Yeah, I agree. And it's not that I'm not confident. Like, I know I could do it. I guess I'm just, until I do it at least once, I'm not going to know that process, and I'm not going to be able to troubleshoot in my mind the things I need to troubleshoot until you go through it. Like, Lou, how many implants in were you before you were able to start troubleshooting ahead of time? Like, oh, I did this time, so next time I'm going to angle it this way, or I'm going to cut my flap this way.
A good bit. For example, my best case and all of the 3 days was my very last case
Right.
on Saturday afternoon. It was my best case by far. I mean, the implant alignment was perfect. On the post-operative x-ray, you could see that the spacing was right on. Everything was even. And there's no amount of books that you could read and know enough unless you do it. So with practice, you become better. I mean, obviously, it's common sense, and it's no different for implants. The more you place, the more you get the feel for it. And once you get a routine and you know what you're looking for, you know where you're going. And patient selection is also very important, especially when you're starting out. You want to select patients who are relatively healthy, who have a relatively good amount of bone density and quality, and just be selective.
I agree. So now let's say you go to this course, you go to any course, and you want to come back and implement this. Like, there's so many more dynamics into having successful implants than just being able to place them and restore them. Like, the big thing is you have to have a team around you who also understands, how to manage implants, how to care for implants, how to manage complications. How is that for you, Lewis? I know you're kind of in an office, like, you're bringing the implants in. You're leading this show. What's your strategy, man?
So from day one, I've been preaching implants, and from day one, I've been preaching the benefits it brings to the patients. And the office I'm at, they don't do any implants yet, but the assistants are understanding and they're learning. So I think it's very critical to be able to get them to buy into it, because they're buying into something that's real. And if your vision is to offer your patients the best, which is, in my case, people who are edentulous and they have dentures, the best way is to have them secured by the implants. Not only does it hold the dentures, but it conserves their bone for the rest of their lives. They're minimizing that bone loss. They're keeping the way they look. And so you have to get your assistants and your team to buy into it. It starts with your front desk. It starts with your hygienist. And if they can buy into your vision and they can understand that it's okay, this is something that's worth investing, they're going to be your best. I don't want to say salespeople, but they're going to talk to your patients a lot of times before you even see them. So
Yeah,
I think a lot of things are important too. For example, like you can get to the BioHorizons, or in my case, it's BioHorizons, but any implant company has reps, and reps can come and do lunch and learns. And you can do lectures with your team, bring them some lunch, buy them some Chick-fil-A, and put together a little PowerPoint. These are implants. This is how they work. This is how this can change our practice, and just get everybody to buy in. I feel like in my
So
situation,
that's
my
what I wanted.
assistants are.
That's what I wanted to ask about was that idea with bringing on, like, doing a PowerPoint or doing an education thing. And I was going to ask you if you were going to do that, because I was talking at lunch to one of our hygienists, Michelle, about implants, and she, they've had a lot of doctors come through the practice, and each one has had different level of implant education, and they all have asked for different things when it comes to simple things like, probing depths on implants. We're taught with Moody, you don't really want to start going around probing those implants because you're going to break the little connection that you have to the implant itself. So what's your idea for creating like in-office education, Lewis, on educating, getting people up to speed on your level of education with it?
Well, you just got to get everybody on the same page, and you got to put together a protocol that works, and that you can put every patient on that protocol, and that your staff knows what's first, what's next, and that everybody understands that everything is for the benefit of the patient. So I think just my best stab at it and is just to educate them with lectures like that, and do lunch and learns where it's fun and they can ask questions, and you can show them pictures and you have models. And because to a lot of them, at least for my case, it's all new. They've heard about it, but they haven't really seen it. They don't know how it works. And it's your job to show them that. It's your job to empower them and teach them that.
I agree. And it's imperative. I think it's imperative for us. It's imperative for the patients. I kind of think it's exciting to kind of, like, if I was you, Lewis, I would be really excited to kind of start that, to lead that journey in your office. Like, you're the ringleader, you're bringing it in, and you get to create this path.
Yeah, I was just thinking the same thing. It could be so much fun, to have more of a say in your practice, or be the owner of the practice or whatever, and plan lunch and learns like that.
Yeah.
Have lunch and talk about different things. And even if it's something that your team wants to talk about, and you do a lunch and learn, maybe bring somebody in, or even put together a PowerPoint and just discuss it and have food. And I mean, that's the kind of practice I want. Just a fun practice that the patients love to come into, because everybody's upbeat, everybody's learning, people know their stuff, and everybody is a team. I just think it could be so much fun.
Dude, I do too, man. It's like we have that a little bit, but I can see where I can, like, just talking to some of the girls, like, there's things that they want to know about, like, genuinely they want to know, and they've just not had that opportunity to get that training. Like, if they want to know about it, what a great opportunity to implement this into your office.
Yeah.
Do you know what's a really good way, since we're talking about the implant pathway here? A lot of doctors who went to the program, and they can take their assistants with them. And in my case, I have a lab, so a lot of the lab people go, and they're working in the lab, working on restoring the implants. So the assistants are with you learning as well. So they're doing the surgery with you, and they're with the doctors. Like, what better way is that?
Awesome.
Yeah. And they bring in special instructors to take the assistants aside and teach them, this is how you set up a room for an operation. This is how this goes, and this sterilizes here. And they teach them the whole process. And there's nothing better than that.
That's awesome.
I wish I could. Oh man, I wish I could do that. That's huge. Do they teach them anything like treatment planning wise too? Like maybe how to present things?
Yes. Yeah, that was a huge thing. So some offices took their front desk people, and they brought in some speakers for marketing, and they told them about financing and other options for patients to do the treatment plan that they want to do, but can't afford it. They're teaching them, okay, this is what you should do. This is how you should offer. This is how you word things. And so that was a whole cool experience, because if you're taking your whole office to something like that, when you guys come back, everybody's on the same page, and it's just, full bore after that.
Dude, that's
I'm
the
in a
key.
difference.
Getting everybody on the same page and communicating the goals with everyone. That way everyone knows. It's not like you're going to a course and coming back and saying, oh, we've got to do all this. It's like everybody goes, or at least your lead people go. So it's like, oh yeah, this is awesome. This is how we do it.
It's exciting, man. And they get excited. Your team and your office get excited because say you're an office that doesn't do implants and you're wanting to implement it. It brings them pride in their job. It brings them pride to know that they work in a place that is wanting to learn better things and wanting to bring in cutting edge technology to better help their patients.
Mm-hmm.
So once they have pride in what they're doing and they get the interest in it, and you empower them with what they need, you invest in them, and yeah, it's awesome. It's a good feeling.
That's really cool. So what's your how confident are you now to go plan this stuff, man? Like, what can't you do now?
Well, I'm 3 months out of school. So,
Isn't that Stop right there. Stop right there. You're 3 months out of dental school. You placed 40 implants.
yeah,
Surgery
I've placed 40
residency,
implants.
Perio residency, buddy. These specialists aren't touching that.
Well, I could speak for myself. And I mean, I was in third year trying to decide, should I do a residency? Should I just go out in private practice and go to the continuing education courses that I want to do? And ultimately, that's just a personal decision. And everybody makes their own decision based on the facts that they have. This is the path that I chose. And I'm happy with my situation. I'm happy with how it turned out. And going back to your question, there's a lot I don't know. If I ever make the mistake of thinking that I know all of it and there's nothing I can't do, I mean, that's a huge mistake, because what that will do is that will keep me from trying to be better and trying to learn more. And what that is that is a disservice to my patients. And
Yes,
my
sir.
goal is to be the best at what I do. And so I'm always going to be trying my best to do what I can. I can do a lot with just what I learned and what I took from the experts this weekend. I feel completely comfortable in seeing a patient come in with terminal dentition and analyzing everything, consulting and looking at their x-rays and saying, let's do some implants here, here, and here. And this is what you need. And somebody coming in with terminal dentition and me just giving them all on 4. Like, I feel completely confident in doing that. No
Man.
hesitation. If everything goes right and their x-rays look good and they're healthy, there's no reason why I couldn't.
Dude, you're going to do some great stuff, buddy. There's no doubt in my mind you're going to be a pro. You're going to be a pro whatever you do.
So what's your next step with all this, Lou? I know at the practice right now, they're not placing implants at that specific practice, and you said, no CBCT and all that. What is your plan now to get the practice on board and try to start doing that where you are?
So we talked about this earlier and how cool it would be to be an owner of your practice, because if you're an owner, you call the shots and they march to the beat of your drum, right?
Yep.
So I'm an associate. I'm there to learn. There's a hierarchy, and I respect the doctor and I respect how he does things. I have the skill set to be able to do what needs to be done, but I need the supplies. So I need a motor, and I need some different things that need to be ordered. but that's my next step. My eventual goal is to have my own office, to have my own team, and this is what we're offering everybody, because there's the best solution. And you have to give your patient the ability to say no to a treatment. Your job is to give them the best possible solutions to their problems. And if you can't offer them the best, then you're doing them a disservice. So that's where I'm at. I'm ready to roll. I'm there with my team and my doc, and I'm there to support everybody and to be a team player, and everything has its time.
Just let me come
And
shadow,
in the
man.
meantime, I'll be doing CE.
Let me come
Yeah,
shadow
man.
you
There's
on my day
some
off.
things. There's a lot of cool things to be said about being in a corporation, because they can do things to help you. For example, there's opportunities for me to go and place implants in other offices that, that's not my office, but that I can go and do implants just because the corporation has so many offices. So it's nice to have that flexibility.
That's awesome, man. Really cool. I'm excited for you, buddy. I'm excited to go down there myself. We'll have to get together and go over some notes and stuff. Coach me up. So, Cole,
Yeah,
man,
take some water with you.
I'll be taking water and a bunch of tacos and burritos and all the food
It's
I can get
hot,
in
man.
my
It's hot in
backpack.
Phoenix.
Hey, Cole.
Yeah.
What's it like down there in Florida, man? We've not talked to you in a little bit about your residency. How you doing?
It's going well. Lot of variety of different things that we're doing. I got so yesterday I finalized a treatment plan, got it signed for 6 implants on the top, with a connecting
Nice.
bar and overdenture, and 6 individual implants on the lower to get him in first molar occlusion. So we're starting that this coming week. And so get the ball rolling on that. We've got some other implants planned, ready to go. Got some IV sedation ready to go. Tomorrow I'm actually doing a fibroma removal.
Really?
The patient has a fibroma between 5 and 6. So we're going to remove it, cure it down to the bone, and then do a CT graft from her palate and put it in that area. It's been curetted before and it's come back once. So the dental insurance wasn't going to cover it anymore. She has Medicaid. So we pushed to get it covered through medical, and medical is going to cover it, her medical Medicaid. So
nice.
she's going to come in tomorrow and we'll remove the fibroma and curette it down to the bone and then do a CT graft. So that'll be fun. And then it's just
Take pics, man.
Yeah.
Yeah.
Post it.
Yeah. The only thing is it's hard to get pictures with our phone down there because we're technically not supposed to have cell phones in the clinic.
Yeah.
And so I'm trying to get a bigger camera, but I'll try to get a couple.
Get a camera.
Cool.
Yeah.
So
it's just
what's
not cheap.
been like your biggest adjustment or struggle starting out down there?
I would say the biggest struggle was just trying to learn the system of how things are done.
Mm-hmm.
Where stuff is. I mean, and then you're doing procedures that you haven't really done much before. Like tomorrow, I mean, I've never done a CT graft, never removed a fibroma. So it's stuff that you see that you've never done before that you got to research and then, try to do it. And you don't know exactly what you're doing. So, like tomorrow, there's going to be a periodontist there that can help me along the way, or I can ask questions too during the procedure. So I'd say those are the 2 biggest things, just learning the system of how things are done, just like it is when you in any new place
Yeah.
you go into, just learning how they do things, and then And then the other biggest thing is just doing procedures I've never done before. So it's just a learning curve with it. Today I had 4 wisdom teeth. 2 of them were full bony. And just trying to get in there and access them.
Nice.
It's just way back there in the back of the mouth. And, just stuff like that. It's just trying to learn the best way, most efficient way to do it. And it just takes time, and you just got to do more than one for stuff to start clicking, and get your speed up with it.
Let me ask you a question. Knowing what you know now and the months that you've been there, do you feel like you've made the right decision in doing a residency, or do you think sometimes that maybe you should have went in a private practice instead?
The only times I have been frustrated are with the assistants. So there are supposed to be 13 assistants for 12 residents. Well, they're separated into teams. We have, among the 12 residents, there are 3 teams. So there are 4 residents per team. And so you're supposed to have assistants assigned to that. Well, our team, one of the assistant moved here recently from Cuba, and he's just kind of rough and doesn't have very good patient skills. And so that's been difficult to work with him. Another one, just have a hard time with her, like staying in the room and helping the whole time. She just tends to disappear. So that's really been the only complaint I've had at this point. I'm very satisfied, very pleased with the amount of experience I've gotten so far and the quality of the mentorship that you get. Because, you're not just working with 1 or 2 doctors. You're working with specialists who really know what they're doing. You're working with general dentists who really know what they're doing. I really do feel like it's a very good, well-rounded program. We talk about how good it is to have good mentors, and I feel like that's one of the biggest things down here is I can learn from some people who really, really know what they're doing. And so I've been very pleased so far.
That's good, man. That's what it's about. It's cool. We're all in different situations. Like the 3 of us talking right now are in extremely different situations, and we're learning different things and bringing different insights. So it's pretty cool. Quick update for everyone. Just got a text message. Matthew and his wife are at the hospital right now. Also,
No way.
have their baby.
No.
So get this, everybody. John Wesley and Matthew, best friends since they were little bitty, like grew up together. Their kids might have the same birthday. You will know next week.
They couldn't have planned it any better.
That's a crazy story, man.
Isn't that weird?
Knox and Seb.
I hope they do come out the same time.
I hope it's the same day. I'm kind of pushing
The exact same second.
the same second. So,
All right. Well, this has been a fun one.
yeah, this has been a good episode, guys. It's been
real, guys. Joe, are you going to sing the national anthem to close us out?
It's been real cool. If you would sing a little bit of the national anthem for us. I've got the American flag waving behind me.
Oh, Canada.
Hey, we have several Canadian listeners, so thank you. Hey, quick story.
How many countries are you in now?
40. So I got something funny. Hold on just a second. I want to say this.
Oh my gosh, what are you
Tell
doing?
us, Joe.
So we talked the other day about funny things that are said in the dental office that we say. So my assistants are reminding me of some stupid things that I say now. One example, the other day I was doing a root canal, and I don't know what it's called. Maybe the endo activator. It like kind of goes. It's a working length. It kind of vibrates and it goes into the canals. kind of gets the solution in there, like the Q-Mix and stuff. Anyway, I needed it, and I told my assistant to hand me the vibrator. And I did.
Which one did she hand it to?
Like in my head, I'm thinking. Yeah, that was kind of weird.
Did she say something?
Not that day. The next day, I'm seating a crown, and we milled it, and the contacts were like a little too tight, so I kept having to adjust it. Finally got it to seat, and I'm like, yeah, it feels. I'm like, yeah, that's a good contact. I'm like, I like it nice and tight. and I guess that she thought that was the funniest thing. And in my head, I'm like, I kind of knew that was borderline. Could have been inappropriate.
You're dirty,
So,
Joe.
Yeah.
You're a dirty boy.
Come on, Joe. You're gonna have to be careful.
They reminded me it was. I need to watch what I'm saying because I guess you don't think about it and you say stupid stuff. Y'all have never done that, I'm sure.
Never said anything.
Happens to the best of us, buddy.
Anyway, well, everybody, thanks for listening. If you're watching on YouTube, thanks for watching. Hope you like our background. Don't forget to go to Facebook, like our page. Follow us on Instagram, Twitter. If you like what we're doing, leave us a review. Let us know what you think. If you need to reach out to us, you can go to our website, send us an email, lifeanddentistry.com.
And go check out Implant Pathway.
Yeah, go check out Implant Pathway.
And follow.
Check out Implant Pathway.
At Lewis.
And follow us on YouTube too.
At Lewis. At Lewis Mariuso. DMD on Instagram. At JD Mood. What is it? 87 or 67 or whatever.
69.
All right, y'all. Thanks
Fireball.
for tuning in. This was fun. Thanks, Lou, for giving us all your knowledge and wisdom. And until next time, have a great weekend. Have a great week next week, and we'll see you in about a week from now.
America.
See y'all.
Deuces. I'm gone.
The Dental Podcast,
Where real people, real stories.
and real life come together.
This is the Life and Dentistry Podcast.